Welcome, everybody. Welcome. It is so good to see you here today. And just to let you know before I go into the beginning of our session, you are able to receive CEUs for attending this session. Yes, you are. And to get them, you can go check out the registration desk before you leave today. Or you can also go to the AMCHP app, and you can just follow the instructions on the app to get that. I just ask that you would please silence your phones, just for us up here and the panelists. And today you are joining us in this session called Engaging Families and Strengthening Resilience, Stories from Healthy Start. And you might say that I'm kind of biased, but honestly, I feel that AMCHP has saved the best for last. Thank you, AMCHP. So I just want you to high five the person next to you or across from you and say, I'm in the right place. I'm in the right place. At the right time. Thank you again for coming. My name is Christina Lottie, and I am serving as the project officer within the Division of Healthy Start. And today, as I'm going to be moderating this session with you, we have heard the federal programs are increasing, seeking authentic, effective, and cost-effective solutions to engaging families in ways to strengthening family resilience, to achieve positive health outcomes. Healthy Start serves as a model to promote families, fathers, mothers, partners' involvement both prior to and after the baby is born, providing parenting support and education, utilizing a trauma-enforced approach to care, and strives to support the mental and behavioral health of mothers, fathers, and families. So today we're going to hear from our esteemed panelists that I have to the left of me, who have effectively and creatively demonstrated this work through their Healthy Start programs. It gives me a great honor and a privilege to introduce our panelists today. So before I do, I just want to see, is anybody in this room representing Louisiana? We have with us Mary Schulteis, who is the founder, president, and CEO of Crescent City Family Services Pick Healthy Start, formerly known as Crescent City WIC Services Incorporated, one of the only nonprofit agencies in the country serving as a WIC program and a Healthy Start program combined. Crescent City Family Services is headquartered in Jefferson Parish and serves over 3,500 clients within this parish and the surrounding parishes within the greater New Orleans area. Mary played a contributing factor in the rebirth of the WIC program post-Katrina, and she's going to share with you more about that soon. You will hear more about her story in addition to her post-Katrina experience as she talks about the combination of her program, WIC, and Healthy Start. So, we also have with us, anybody in the house from Texas? Texas? Just a few? We have with us Corey Eberly, and who has been the project director for San Antonio Metro Healthy Start program since June of 2015. Corey has authored and co-authored and presented at several state and national conferences on health equity, social determinants and disparities in maternal child health, fetal infant mortality review, place-based initiatives, breastfeeding, and collective impact. Is anybody in the house from Missouri? Woohoo!
Oh, okay.
Missouri is represented. We have with us Ms. Cynthia Dean, and she is the Chief Executive Officer of Missouri Boot Hill Regional Consortium, Principal Investigator, Director of the Healthy Start Program. Ms. Dean's background contains more than 25 plus years experience working with community-based and grant-funded programs. She received a National Leadership Award in 2013, recognizing her ability to improve opportunities for rural, underserved families. We will keep you guys engaged in this session with some exciting little trivia questions as we go along. So all of you, please stay tuned and be ready for that. So please, if you can just put your hands together for our lovely esteemed panelists to the left of me. So before I give them the mic, I just want to share a short video that I found actually last night. It took me a while to kind of search through to find something, but I just wanted to share with you an experience of a participant within the Healthy Start program, because it's all about the participants of who we serve in the program. And this just captures what Healthy Start means to her.
My experience with Preterm Healthy Start, when I first started, my resource mother was there for me the whole 100%. When I was actually pregnant, me and my baby's father was going through our stage where we wasn't talking, he was not there. Now he's here 100%. Whenever I need something, she's there. Not only her, it's actually everybody that participates with Preterm Healthy Start. And overall, my experience, it actually makes me want to stay a couple more years. Before I started with Preterm Healthy Start, I didn't know how I was going to get through this. I didn't know where I was going to be at after I had her. I really didn't think that everything was going to fall into place. After she was born, my resource mother actually came to the hospital to see me. When I left to go home, she made sure I had everything for her. She made sure she had a playpen, everything. Actually, everybody from Preterm Healthy Start actually was calling me, making sure I was okay, and wanted to see the baby and everything. Without Preterm Healthy Start, I don't think we'll be nowhere, because it helped me grow into a mother, and I know it really helps him grow into a father. Without Preterm Healthy Start, I don't even think he would be here. I look at Preterm Healthy Start as my family. If I need anything, I don't hesitate to call.
So this is just one story of many stories of the participants that we serve across the U.S. And so as I mentioned, I want you guys to be involved in, let's see here. I want you guys to be involved. Thank you. Get it out here. Yeah, but it doesn't.
No, it was they went to YouTube.
I want you guys to be involved in the trivia question. And so the very first one I have for you is the purpose of Healthy Start. What do you think the purpose of Healthy Start is? So I'm just going to read these. The first one is to promote school readiness for children ages birth to 5 from low-income families by supporting development of the whole child. Or B, to provide specially trained nurses regularly visit young first-time moms-to-be, starting early in the pregnancy and continuing through the child's second birthday. Or C, to improve health outcomes before, during, and after pregnancy and reduce racial ethnic differences in rates of infant death and adverse perinatal outcomes. And I'm just going to have you guys raise your hands. All in favor of A? Okay, we have a few over here. B? Anybody choosing B? No one. And C, all right, yes. Good job. The answer is C. You are right. So in 1991, the Health Resources Services Administration, HRSA, of the U.S. Department of Health and Human Services, funded 15 urban and rural sites in communities with infant mortality rates that were 1.5 to 2.5 times the national average to begin the Healthy Start initiative. These programs that you see on our slide are the first 15 that were established through this Healthy Start initiative. The program began with a 5-year demonstration phase to identify and develop community-based service approaches in reducing infant mortality by 50% over the 5-year period, and to improve the health and the well-being of women, infants, children, and their families. The program has grown over the years, and currently there are 100 federally funded Healthy Start programs, woo-woo, in 37 states and the District of Columbia. Over its first 25 years, Healthy Start evolved from the program focused primarily on improving pregnant women's access to prenatal care, to programs seeking to improve women's and children's health from preconception to early childhood, creating the foundation for optimal infant and young child health and development. Currently, our Healthy Start programs serve women of reproductive age, pregnant women, mothers who have just given birth, and infants, fathers, and their families, from birth to their child's second birthday. Healthy Start involves fathers, as I mentioned earlier, male partners, and supports couples with reproductive life planning. Please put your hands together for Healthy Start. Now then, in 1998, soon after the development of several other Healthy Start programs, in addition to the 15 that were originally funded, the National Healthy Start Association was established. As you see on this slide are some examples of the roles and the functions of the Healthy Start, the National Healthy Start Association. You're going to hear more about that from one of our panelists. The association, in partnership with the division, help move the needle in reducing infant mortality. You know, I had the pleasure and opportunity to listen to Mr. Charles Johnson. Did any of you guys hear Mr. Johnson the other day? Wow, yes. He was extremely powerful, moving, and emotional to me. And it's just an example of what he's doing, the power that he has to move the needle, and he's doing great things. While most women have a safe pregnancy, as he mentioned, and delivering a healthy infant, that is not the experience, right, for all women, as he expressed and clearly shared with us about his wife. Major and persistent racial and ethnic disparities exist for pregnancy-related maternal mortality and morbidity, infant mortality, and the adverse outcomes such as low birth weight and preterm birth. With the new upcoming 5-year project period, 2019 to 2024, Healthy Start will continue to fund 100 programs with now a focus on a system of care that aims to, as you see on the slide, improve women's health, improve family health and wellness, promote systems change, and ensure impact and effectiveness. Within the highlighted approach, as you see on the slide in red, the programs are also expected to reach no less than 100 fathers or male partners affiliated with Healthy Start women, infants, and children, for a total of at least 700 program participants per calendar year. And each program, I know for a fact, will successfully do that. I would be remiss if I did not mention the Healthy Start Epic Center, which is the technical assistance center for all of the 100 Healthy Start programs. The Epic Center's team has done a fabulous and fantastic job at providing technical assistance and resources for all of the Healthy Start programs to grow and thrive. So here is another question for you guys. Are you ready? All right. Healthy Start has been around for A, 5 years, B, 10 years, C, nearly 30 years. Answer? C. Yes. You are right. Recently, they actually celebrated 25 years of the National Healthy Start program. So during the last funding cycle, as I just mentioned, we're just serving 100 programs nationwide. And by now, those of you who did not know about Healthy Start or weren't familiar with it, as you know, it's a national federally funded program of care and grounded in community-driven strategies that has been around for almost 30 years. Through a care coordination, case management model, Healthy Start aims to improve infant mortality and poor birth outcomes in communities most heavily impacted. And as you've heard, Healthy Start engages the whole family. This is the whole family as one unit, not just the pregnant woman. We will focus on family resilience aspect of the Healthy Start program in this panel discussion today. And with this background, we're going to jump into the next trivia question. Father involvement is related to positive child health outcomes in infants, such as improved weight gain in preterm infants and improved breastfeeding rates. True or false? True. You are right again. That's right. And you know, now it's amazing that I have next to me the panelists that are going to really talk to you guys and dive into this on how they promote father and partner involvement both prior to and after the baby is born. Dr. Warren said something the other day, actually this week during the conference. There were 3 words that Dr. Warren said in regards to things that he wants to focus on, things that he wanted to describe MCH and make a primary focus on. I don't know if you guys remember those 3 words, but I want you to tell me if you do remember the first word that he said. Does anybody know that? In the back. Yes, you guys got some good memory. Yes, accelerate. So our panelists that are before you today are going to go through and accelerate through their Healthy Start program and just give you a glimpse of what they are doing to accelerate and move the needle to reduce infant mortality. So the very first question I'm going to address to the full panel here. And this question, I'm going to start, everybody feel free to answer. I'm going to start with Corey with this question. And the question is, yes, what is the question? Okay. So the first question I have for you that I want to address all of you today is how, through your programs, how are you addressing the fatherhood involvement, and how has that been a part of your program? How have you incorporated father involvement, male involvement, and family involvement within your programs particularly? And I'm going to start with Corey.
Sure. So at the heart of San Antonio Healthy Start, we are a home visitation case management program. So we're in the homes with moms. And that really gives us an advantage in engaging families and dads because we are in the home environment. And often other folks who are caregivers for the child besides mom or the baby once it is delivered are there in the home with us. So that is a primary opportunity that we have, is to use that home visitation model to be able to engage other folks who care for baby. And that does have to be an active process. Mom is really a gateway to engaging dad. We have to think about social fathers as well as biological fathers and really engage male involvement as it's happening in the child's life to make sure that we're maximizing opportunities for any male who is caregiving for the child so that they can have that influence. We talked about, all of y'all are very knowledgeable about the purpose of Healthy Start, and because our mission is to reduce disparities and to address health equity, it's critical that we engage dads and everyone who's involved with the child, because if we want to close the gap on those disparities, we have to engage everybody who is surrounding the care of a child. That adage, "it takes a village," is really true. There's such supports that can come from people being engaged and knowing. When we think about that trivia question about breastfeeding and weight gain, if we have other folks besides mom who engage in the process of feeding baby properly and helping mom be supported while she breastfeeds, that's how that happens. So in the home, very critical, but you can't stop there. We've got to go wider. We at San Antonio Healthy Start also host monthly parent talk meetings that we open up. We have an educational topic. It also allows for some networking and social connections for families. It is open to the public, but I will say it's mostly our participants and their families that attend these monthly gatherings. We have 3 geographical sites, so we host one of these at 3 different areas in town monthly. And when we engaged a fatherhood coordinator, we actually employed a person to specifically start focusing on father engagement, both during pregnancy and after the child is born. We branched off and expanded this parent talk concept to having dad talks, because we found just by talking to dads and doing some surveying that dads wanted a safe space where they could talk about the issues that are important to them and the topics that they felt they wanted to learn more about. So in addition to our parent talk, where dads are encouraged and welcome, they also have a monthly meeting where they can come together with just daddies and talk about the things that they can do to help support mom and baby. We also have events in the community. We don't want to just stop with the dads that are involved with our Healthy Start participants. To get that community level engagement, we want to make sure that we're doing things in the community offerings, outreach, education, and events that we do that engage papas. So we make sure that we have activities that are welcoming and appealing to the males in the community. So we often have some sports type things that are involved in our community events. We often do specific things to engage dads, like have them host the reading circle during our events and have them do story time, and really look for ways to draw the dads into things that they do. And also discussions when we do town halls on things like barriers to prenatal care or postpartum visits. Talk about how dads are so critical because they can provide childcare while mom goes to her appointments. They can do things like we talked about, support breastfeeding, diaper changing, those kinds of things. Dads don't often get training on those kinds of things, so bringing those educational components into all of the activities that we do and weave those in really help. We have baby showers that we do in the community, and we make sure that we involve daddies in those too. We don't think those should just be a mommy activity. Dads need to celebrate the welcoming of a new child in and get the education just like moms do.
Okay, good morning. I first want to acknowledge where the Missouri Boot Heel is, because we changed the name when we first started twice. And so we're at the very end of the state. If you look on the map at Missouri, you will see that the end of it is shaped like a boot. And it has the third largest population of African Americans outside of Kansas City and St. Louis. And so we also are unique the fact that we have Tennessee, Arkansas, Kentucky, and Illinois. You could be in Chicago in 5 hours, St. Louis to Memphis to Kentucky hour. I mean, we're there. So I wanted to make that clear. Now also, male involvement is so precious and important to me. I served as president of the National Healthy Start Association in Washington, D.C. for 3 years. And during that time, one of my biggest passions and advocates were to promote male engagement, along with Ken Harris and some of the other leaders that are there now. So I've been involved in male involvement for many years and continue to do that. And as the leader of our organization and the project director for Healthy Start since 1997, I have made sure that our organization has been integrated into male involvement, every aspect of it, from the data to the marketing, to the community, to the pamphlets, to the brochures. You will see all of that. In one of our brochures, you can see that this is a new brochure because we have a new program called Male Empowerment Now. Many of our Fatherhood First programs, that was the name, Fatherhood First, where we've had many activities, but the Male Involvement Now is a new program where we're really focusing in on dads with parenting and education, and we recently received a large Department of Health, Department of Justice grant to work with reentry so we can get the dads back in the community. So we're really excited about that opportunity as well. The next one is that I'm a big fan of social media because marketing now is on your phone. Communicating with people, as you know, is on your phone. Your phone is an extension of you. So we do billboards. So this billboard here that you see, it will be posted at the end of this month. We just had another billboard posted about a week ago. That's the face of our website. So we have that. So this one will be posted at the end of March. So we're very proud to have that posted on Interstate 55 North, like you're going to St. Louis, so everyone will see it. We recently worked with many of our ads focused on, we have a program where we work with dads, and the picture that you see here are men that have recently graduated from one of our programs. And we have 2 coordinators that work with them, and this is an 8-week program. And so we're very excited about this particular class, and we have a graduation program with all of our fathers in many of our programs. The next slide is a fishing clinic activity. We've had this event for many years. So you see the 20th, this year will be the 21st. And this is co-sponsored by Walmart, the Department of Conservation. We have officers, we have people that come in from all over the states. And this also has spilled over into Kentucky, Illinois, and Arkansas. We have people that come there. It's also supported by a lot of our churches. And this is a wonderful event where we have opportunities to showcase many of our partners, their events and activities and their screenings and their education opportunities. So we've been doing this for many years. And so this is another piece of just showing how partnerships, but these pictures on our website, they're priceless because sometimes this is the first time that many kids have ever been on a boat, they've actually ever fished, and now we've integrated archery, so they know how to shoot. They have the little deer out there. Or, you live in Missouri. Deer hunting is a big deal. They actually let the kids out of school for a whole week in November, so it's a big deal. Okay. All right.
Good morning or good afternoon, everyone. I just feel like I need to stand up. Is that okay? Okay, good. I'm truly honored to be here today. When I look at the picture that you see up there, it's worth 1,000 words. This is my family. I just look so forward to being on a national platform and being able to introduce my family, the strength, the resilience that it took me to get through Katrina. Early on, you heard Christina mention, I was so honored to be a part of one of the first projects in New Orleans. And without the support of my family, it would have been impossible because I was there several days after the storm. On the next slide, you will see my mentors. Miss Aggie Williams, that's standing on the end. She actually has 25 years with Healthy Start. So to be able to be mentored by the best community relations director in New Orleans was truly another hurricane I faced when I met her. Angela in the middle, Angela Hayes Tolliver, 25 years, was my first project officer. And Charlotte Parent was also one of my directors. So in meeting Angela, you better know the history, you better understand it, or they would all correct you. and Deborah Frazier also, and Ms. Dean is sitting here, and I added her to this slide because Ms. Dean is truly one of the sheroes of Healthy Start also. So let's give her a big hand. Healthy Start was my first foundation into maternal child health. I'm a nurse by trade, and I had the passion for people, but I knew, and I'm holding on to this rock. I got this rock from the kids from Puerto Rico, but you know your rock, your strength, and what you need. And I wrote on here to believe, and that was one of the key things. In my next slide, you'll see that after working with Healthy Start for 3 years, I stepped out on faith and was asked by the state to become a WIC service provider to an underserved community. And many of you all know, as Ms. Cynthia mentioned, the boot, Louisiana truly is a boot. And so it was the area where the BP oil spill happened, so another disaster. But prior to that, I was asked to bring WIC services to the community. So I named the agency Crescent City WIC. I really limited myself when I named the agency Crescent City WIC because I had no idea what I was getting into. But I was diving deeper into maternal child health. So after 5 years, the opportunity came up to apply for the Healthy Start grant. I'm like, okay, let me see if I can do this. So we wrote a title. We called it A Perfect Match. A Perfect Match. So 5 years into WIC, another 5 years, we named the project, the Healthy Start Project was named Crescent City PIC. So I knew that parents, infants, and children is what we wanted to make sure. So if you notice, many of you will look at the logo, is actually the logo of the National WIC Association. We added a dad to the picture. We knew that early on. Added a dad and added a little extra hair, I say. We had to add that flavor that I knew that it would be just a little different, that I just wasn't taking someone's logo. But the Perfect Match was the title. We knew that both programs, we wanted to streamline services. We wanted to integrate services. We wanted to create what was called a one-stop shop. We were serving thousands of women. So we didn't have to look for the women. They were going to come to us. And so now we just had to add the icing on the cake to what we already had. So Crescent City Family Services was born as a result of that. We basically, after a while, just kept saying WIC and PIC. So we say, you know what, 5 years of WIC, 5 years of Healthy Start, why not just become a unit and become a family? Why not just marry the two programs together? Because that was our goal, was to integrate the two programs. So we decided, you know what? October 1st of 2018, we changed the name in the midst of writing a grant. Don't ever do that, okay? Please don't do it. So I have to say, Crescent City Family, WIC, and formerly this and that, but we're a Crescent City family because we saw it early on. There's a picture of our Crescent City family. Not only did you see the picture of my family in the beginning, I have a family at work also. So this is our family. I have Kathy and Courtney here today, and y'all wave y'all's hand. Because what I will honestly say that integration cannot happen unless you have two people who believe in what you believe in. And they believed in me, and that's why believe is on this rock. They believed in Hurricane, I want to say Mary at that point, that because things was happening fast. And to be a part of Healthy Start and to see how we can strengthen families and work with families and include dads. You know, when dads walked into the WIC office, just showing them the respect. One thing, Healthy Start, we're going to recruit 100 dads in the next funding cycle. We're not just going to count dads. We're going to let dads know that they count. And that's one of the phrases that Ken Harris always used. We're not going to just count them by numbers. We're going to let them know that they truly, truly count. So we named our program the 504 Dads. You know, I use a little bit of New Orleans in everything I do. You know, so the 504 Dads, you know, we're committed to our dads, we're committed to our families, and when you create that unit, the word family just will echo. A couple of mottos that Miss Aggie used to always say: healthy mom, healthy baby, healthy family, healthy community. And she would repeat it. It was on handouts, it was on brochures, anything we could write it on. She said, Mary, don't you ever forget what we're here for. We're here for the families. We had to go into shelters during Katrina. We had to go find families wherever we could. We had to leave New Orleans to go to Baton Rouge to find the families and say, look, please come home. Texas is my home. My roots are here, but I can tell you my branches are all over the world, and especially in New Orleans. That's why I have a little twang, a little Texas. So when everybody was saying, woohoo, I was saying when I left Texas, yeehaw. And then I got to New Orleans and said, who that? You know, so believe me, you will engage and pick up the culture wherever you move. And like I said, I probably wrote a few things down, and I hope I didn't miss them, but I can assure you that AMCHP and coming to this conference, and everybody probably saw me taking thousands of pictures. I have 40,000 pictures on my iPhone. But my most favorite picture was to look into the room and see so many people all on the same mission. Louisiana has so many challenges. You know, we're #1 with maternal mortality. We have high infant mortality, low breastfeeding rates. We have so much work to do. We have, and the only way we can do it is by being embraced. And so on my next slide, you will see this was a bucket list picture. You know how you just get a picture and you say it's on your bucket list, or you do something? To get the National Healthy Start Association president and the National WIC Association president in the same room. And I say, y'all hold up, this is my bucket list picture, because pictures are worth 1,000 words, because their missions are in alignment. Like Douglas Greenaway would say, we're the happy, healthy baby people. And then Deborah Frazier, every baby deserves a healthy start. And I've heard him say it over and over. And when you can embrace two national organizations that are our advocacy, that go up on the hill and fight for what we're doing every day, mission accomplished. Y'all say that with me. Mission? Yes. I'm so excited. I want to thank JSI and the Epic Center, because what they were able to do was help us with a Louisiana Fatherhood Collaborative. We're finna step into some waters that, you know, as women, it's not going to be our room. It's not going to be our man cave. It's not going to be for us when you start working with fathers. They're going to have to learn how to create their space, like Corey said, and give them what they need and let them decide how they want to do it. We as women might just have to make sure the food is there and a few other little goodies, but it's going to be their space. So all 4 Healthy Start projects came to New Orleans. Everybody who wants to come to New Orleans, y'all say, ooh, yeah. It's not a problem getting us together. We have so much love for each other, all 4 projects. You know, we celebrate. It's sad that we have 4 projects, because that means our babies are what? They're dying. But when we come together, we think about what we can bring to the table as a group. So the Louisiana Fatherhood Collaborative was exciting. We had fun, we had music, we had food. We did what we had to do, but we discussed how we were either going to provide services to our dads or do a full-blown program. So you have to decide which one we were going to do. So I had an opportunity to also go to the Fatherhood Summit over the past 5 years. Actually, we were a first-time grantee in the last cycle. And what I have on this picture, as it says, the founding fathers of our fatherhood mission. You know, we have a good, solid foundation to start with. I am so glad that I was able to attend all 5 and learn, and not be so afraid that if we are a grantee in the next funding cycle, we already have a good foundation to start with. A foundation of men who have been working at it and making sure that, you know, they were out there advocating for fathers and dads, and knowing how important dads are. As Christina said, I had a chance to meet Charles, and I said, look, my name to you is Aunt Mary, so don't call me nothing else. But what he's doing, like he said, he's on a rocket, and all we have to do is see if we can catch on. Like Christina said, we're going to accelerate, guys. So if y'all ready to, you know, we're some movers, we got to be some shakers, we got to do what we have to improve maternal mortality. Get this number down to 0. Get our dads where we're not just going to count them as numbers, and that they feel that they truly are going to count. So I'm excited. This picture is really nice. I think it took Charles for like a shock, because one thing when he came to the conference, his presentation was on maternal mortality. He had no idea he was going to be given the Fatherhood Hero Award. So his angle shifted. And it was like, wow, yes, you are a father, and you're doing great things with your son. So it was an emotional moment for him to be awarded for the work that he's doing with his 2 sons. So I'm excited to see and continue to see him on the platform supporting us in our, you know, fatherhood initiatives and our maternal mortality initiative. So guys, don't just pin yourself in with one angle. Always come up with all the different angles that you can do to strengthen families, resilient, and make them resilient. I think that probably is my last slide. And I came up with my own motto. I played on words, pick PIC, which Pick Healthy Start to begin your path to a healthy pregnancy, brighter future for you, your baby, and family. So family is echoed all through our agency, and we stepped out and made a big decision to change the name to Crescent City Family Services, and we're happy about that. Thank you.
Thank you to the panelists, and we are accelerating. The second word that Dr. Warren mentioned was what? Upstream. Repeat after me, upstream. We are going upstream, and with that, our panelists are going to discuss and dive more into what that means. I have a next question for our panelists as we're moving along and being mindful of time. I'm going to address the full panel with this question, and it's how have you measured, now that we've heard about fatherhood and family engagement, how have you measured whether these strategies that you've implemented in your Healthy Start program has actually worked? And we're going to start with Corey.
So I'll keep it brief, but one of the things that we've done in this 5-year cycle that I think is really critical is that we have worked to develop some standardized screening tools that really capture all of our 19 to 20 benchmarks and performance measures, including the 2 benchmarks that we currently have for dads, which is engagement during pregnancy and engagement after pregnancy. So I think the screening tools are really important to talk about, and they really are the mechanism right now, and in addition to whatever programs are collecting in their individual case management processes. We look forward, though, to that inclusion of dads as a hard metric this year, where we have to engage 100 guys, and we know that there will be things tied to that where we will have to have better tracking, and I think we're all looking forward to that. And really, the evidence-based curriculum and evidence-informed curricula that we're used to using with moms and babies, I know most programs are gearing up to apply that to dads as well. And so really looking forward to being able to kind of put the bow on what we've started as the total package with engaging fathers, which is that evaluation piece and the tracking and monitoring piece.
If it's not documented, it's not done. We are a data-driven organization. And we document everything. We have a full-time data manager internally and an PhD evaluator externally. So we are sort of ahead. I think even when they started the tools, we already had ours in place. We just had to tweak them. And so we have several tools from some of the, they may not be up there on our slides, but we do have several tools that we have created, and then there were screenshots there, and then we have additional tools that we've modified so that the next one for our men program, we basically specifically created that recently to where all those boxes on each one of those things, you can click down and it has multitude of tools and things that you can go in and put that information in there. Every woman that has been enrolled in our program since we started, we can pull up that number and we have that information. And it's also great tools to really show you what's working and not working. Okay. Okay.
At Crescent City, one of the things, we're using the Well Family System, data system. So they're in the process, and they work real closely with Ken Harris to actually develop the data system that we're going to be using. So we're excited. We're very comfortable with the system we're using, and we know that they're going to work closely with HRSA just to make sure that we have the screening tools. Again, the screening tools are across the board. So all 100 projects use the same screening tools. So our reporting is very good. I mean, we report twice a month currently, on the 10th of the month and on the 30th of the month. So HRSA is actually getting real-time data from all of us. So it will be standardized, the screening tools. And like I said, different agencies are using different data systems, but at the end of the day, we want to make sure, as I mentioned earlier, that, you know, we're going to count the dads, we're going to make sure we do that, but we're going to make sure that dads do count. And so in developing the screening tools, I'm sure it will be, I hope, like I said, having the input of men involved in the questions that are asked. I think that is very important, because even now in the screening tools, there are some questions that can be, you don't have to answer. So there'll probably be questions like that. So it'll be good to see how the rollout of the screening tools will be formatted for dads, and so that dads feel comfortable, and if they do feel uncomfortable, that they have a right to answer or not answer. So I'm excited to see how that is going to be developed.
Okay, we have another poll question for you. If you are working on fatherhood or male involvement in family engagement, have you measured your work? Just a show of hands. Anybody say yes? Okay, no, not so much. I think the majority is no. But if you did answer no, there are lots of resources and tools in the Healthy Start program on the Epic Center. Actually, if you go to healthystartepic.org, you will find lots of resources there that can direct you to some of those resources that can help you to start engaging in fatherhood and family engagement. And feel free to talk more with the panelists after the session to get more feedback on how they have incorporated that into their program. Okay, let's go back. Okay. So I'm going to turn to the panelists again for our last session of this particular topic. And I know we've gone through two so far of Dr. Warren's key focus points. And the third one, can anybody tell me what that is?
Together.
Together, yes. And Mary mentioned about that, and the whole point of us being one unit, one family, is really coming together, and that circles around partnership. So we're going to talk about partnership, our panelists, and I'm going to address all the panelists with this question. What are some key partnerships that you've created that have really impacted the work you're building with family resilience particularly? And we're going to start with Mary this time.
Let's see. Again, pictures are worth 1,000 words. I love to take pictures. In looking at the pictures that you see here, together, I know was Dr. Warren's statement that he said, together we can do it. So we actually named our community action network the Can Do Group. We call ourselves Can Do. Together we can do it. So if you look at the pictures on the slide, there is a lot of New Orleans culture in the room. You see the purple, green, and gold? We just had our recent Community Action Network, and we have an event we call Throw Me Something Healthy. So organizations are brought in, they come in, and they have to let us know, going forward, what are you going to throw out to the community, to our clients? What can you throw us something healthy? So their floats are representative of their float. Miss Trina is actually here. She was our first place winner. And and their float was about lead prevention. We had floats that were about prematurity, our federally qualified health centers. So in this picture too, I want to, if you can see, there's a picture of the Bureau of Family Health. Yes, I mean, y'all better holler back there. It has been awesome working with the Bureau of Family Health, because more recently we have been having conversation about putting together an MOU, putting together a collaborative for us all to work together. And I would say the biggest request of the 4 Healthy Starts across the state is just be a part of our Community Action Network. We're the backbone, but in that backbone, we need the strength of our community to be able to move forward. So having, them there to support us at the bureau level, we couldn't ask for, much more. Also, you will see there's a picture in the middle of the hospital. We were step number 10 in a baby-friendly for Ochsner, one of the hugest medical facilities in Louisiana. I'm gonna say Louisiana. And so we were step number 10. So we were given an award for being their community piece, because they needed us as much as we need them. So together we can do it. I will echo that word, together we can do it. The New Orleans Pelicans. Actually, if anybody wants to go to the game and come into New Orleans, you can go to the game for free tonight. But that's one of our biggest community partners. Also, and the baby in the picture that the mom is holding, he was actually our first Healthy Start baby. Yes, on the day we received the award 5 years ago, she walked up to me and said, "Miss Mary, I have something to tell you." And I'm like, "What?" She said, "I'm pregnant." I said, "Well, you know what? You're our first Healthy Start client." So having their partnership has been very good because we're able to reach dads, we're able to reach families, to be able to go to an NBA basketball game and just have fun and family time. So the support of so many community partners, I can't even begin to name them all because we have over 100 plus community partners. And so partnership, together we can do it. So again, I will echo our motto is together we can do it through our Can Do Community Action Network.
Okay. I think the next slides, I can move this. Yeah. Okay. Partnerships, as Mary pointed out, we have too many to mention, and we can't do it by ourselves. Sustainability should always be at the front of some of the things that you're doing, specifically with community events. And we have, many of our events are co-sponsored by managed care agencies, hospitals, international organizations. And so we really perfected that to where when we do something, we want someone else to help us do it. And not only is it a win-win for us, but it's a win-win for them as well. The pictures that you look at now is that, again, we are big with social media. There's one of our fathers in our programs with his daughter. And also we have an event every year called Hoops for Babies. And we have a lot of guys that come in and they really look forward to this. We have referees and they win and they get serious on the court there. Now, one thing that last year, we're going to have a women's team this year because I got cornered and said, okay, you can't keep doing this. What about us? We can play basketball too. So we're going to do that this year and start working toward that goal. But we have a lot of community events that's focused on that. And with a lot of our education and training activities, we work with workforce investment boards, which provide a lot of the free education and training for our men. And also employment is very important, working with them as well. And recently I did a TED Talk in St. Louis at Washington University with over 700 people. And I haven't had an opportunity to talk about the things with our fatherhood program. So we're constantly promoting and marketing and things that we do with our program throughout the state and different parts of the country as well.
I know we're short on time, and I could probably spend the entire hour talking about partnerships and collaborations. I really feel this is the key to Healthy Start and really driving the needle on maternal, child, and fatherhood health in our communities. So I'm just going to talk real quickly about a few things that we do at San Antonio Healthy Start. We also have a community action network called Healthy Families, and it's about 40 to 50 agencies that have stuck with us over the past 5 years to really address and drive the needle on birth outcomes and eliminating disparities. One of the things that we really wanted to make sure we did with the network was incorporate community voice. So some of the things that we've done within the coalition structure is actually add some adjunct groups that meet outside of our monthly meetings. We have some health disparity councils for target populations. We have an African American Health Disparities Council, a new Spanish-speaking group we call Platicas, a Well Woman, Well Communities, Community Action Board, and something that's kind of special, our place-based initiative, resident leadership team. So using the asset-based community development to go at that neighborhood level and have folks decide what the strengths are and build on those. We've done a couple dozen community projects throughout the 5-year period under the current grant, and this is something that's really important with dads. We've had several daddies within each of our geographical areas find this as one of the places that they really got engaged with the Healthy Start process was through our resident leadership team programs. We also worked with we're embedded in a health department, and we worked with our health department to really advance health equity and looking at everything through a trauma-informed lens. So we were able in the past year to convene a quite large trauma-informed consortium that has about 11 subgroups, different community sectors, really focusing on how we can make San Antonio and the organizations within it trauma-informed and working on things like adverse childhood experiences. So those are just a little bit of some of the community partners that we engage. I think our participants and the people who come to our activities and events are really the partners that make the most difference. And I don't have time to read all this, but we host an annual event called Baby Buggy Walk in the Park. And you know, if we fail to do our jobs the best we can, the the outcomes that we're looking at are actually infant mortality and maternal mortality. So I think it's important to remember that and have awareness for it and have a place for moms and dads and families to celebrate life and get some education so that we can have that prevention piece. And we engage a huge amount of vendors as well as families to come to our annual event. It's always very, very beautiful and moving and educational. And so that's one thing that we really like to do is engage the community and our participants in coming together and remembering what this is all about and what our mission is to prevent infant mortality.
Thank you. Can you put your hands together for our panelists? Amazing. I'm just being mindful of the time. We're coming upon the hour. So I just want to give some time just for 2 questions. And feel free, if you can, to stay after and ask any additional questions that you might have to our panelists. So anyone in the room, we want to take this opportunity to open up for 2 questions. If you have any, please just raise your hand and we'll pass the mic to you. Any questions? Yes.
What you have done in your states is absolutely amazing. Be proud. If you're not, you better be. What about sustainability? Have you been able to tap into other resources? Because grant funding, as we all know, so I'm just curious, especially like from a Medicaid perspective.
I have worked on sustainability. Actually, it's been a priority for our organization for many years. I've taught sustainability classes and trainings, and no grant is forever. I know someone told me that at CDC about 20 years ago, and I was all excited, but it's really the truth, because we've lived up and downs with Healthy Start as the budget went up, went down, and now it's different again. So you have to create the partnerships and sustainability, and the beauty in our organization is that we have many programs outside of Healthy Start. So what I am doing is building opportunities to absorb the positions in Healthy Start in case we don't get funded, but they can be absorbed in other programs. And I've already done that with 1 or 2 of our other grants that have ended. I have 3 diabetes grants that was funded last year. I have, many other programs that we work with, a DOJ grant and other things. But I also make sure that we have men focused in each one of those grants. We have areas that can complement Healthy Start. And we work with our CAN, our Community Action Network. We work with our providers. We work with our legislators. We bring them in. 2 weeks ago, we had Senator Roy Blunt in our area, and I was able to get up along with some of our staff and present on our programs. So you have to build an infrastructure from the very beginning of your program, not next week, but as soon as you get that grant, you need to start looking at how to do that with other partners. Because at some point, those events that I talked about, they come to us. They like seeing their logo on our flyers. They like coming to events, showing their information and sharing and all that. So at the end of the day, it will pay off, but you really need to start it now instead of later.
Yes, thank you. Okay, we have time for just one quick question. Anyone in the room? No? Okay, again, feel free to meet with the panelists after the session if you have any other questions. And I just want to take this time, I hope you've been able to learn something new about Healthy Start if you didn't know what Healthy Start was already before. But I just want to take this opportunity. There's some Healthy Start program directors in the room. And for those who have been affiliated with Healthy Start, I just want to recognize you for the work you do. Can you please stand up, please, and put your hands together for those? The Healthy Start staff, frontline, and those on the ground do a fabulous job, and they work hard every day to do what they do, and they have the heart. So thank you for your work. Thank you again. I just want to thank the panelists that we've had here. They've done a fabulous job presenting to you what Healthy Start is. Thank you. Thank you so much. This is recorded, so feel free to go to the AMCHP website after the conference today and view it again. And again, thank you for your opportunity for being here with us and just learning about Healthy Start. You guys enjoy the rest of your day. Thank you so much.